This is where we rope in the best of Melbourne with columnist with the Herald Sun, Susie O'Brien, joining us from Melbourne, and one of the few sane voices in the nation's capital, 2CC Breakfast Radio host Stephen Senatiampo. Thanks both for joining us. A lot of talk about aged care today, a lot of talk about having to get the wealthy to pay more. No specifics from Labor here, Stephen. Should we be thinking here's a chance for sensible bipartisan reform, as David Littleproud was trying to suggest, or should we be worried they're coming for the family home?
Look, I mean, part of me says that something's got to be done here, and if it's sensible policy, then this is a reasonable direction to go in, because we know that with an ageing population, the cost of the taxpayer is going to only increase exponentially over the next number of decades. But there's always that concern when you've got a government like this current one that they are coming after the family home. So, look, if we can get fair income, bipartisan, sensible policy on this, I think it's a no-brainer. And as much as I'd like to say people should be able to keep as much of their wealth to hand down to their kids as possible, the reality is we need to be able to keep people, they're getting older, we need to be able to keep them in their own homes and keep them healthy. And unfortunately, we're going to have to pay for it ourselves.
No, bugger that. Let the kids pay their own way, I reckon. No, the thing here is, Susie, I think when it comes to aged care, one of the critical things is you get the quality of service that you're paying for. No one's going to resent paying the right money and having to contribute to that themselves if they're getting quality care. And there's been a lot of controversy in recent years. Hopefully we're fixing that, but it's not fixed. You know, we still need to get nurses full-time into all these facilities. There's still staff shortages. So these are big problems to tackle, right?
Absolutely. We need the quality of care, and we also need the transparency in the funding model, so people know exactly what money they're getting from the government, how much of that is they're actually getting for their care, and how much of that is going to external providers. That's a massive issue in the home care sector. But, you know, we can't afford to do nothing at this point, and it would be so good to see a bipartisan approach, as Stephen said. We've got an extra million people who will be needing either aged care or in-home care over the next 40 years. It will double from 1 million to 2 million people. And, you know, we've got a flattening tax base, so people are going to have to pay more themselves. And I think most people would like to see some sort of quarantining of the family home. You know, you work hard, you want to give something to the kids. But if people have got money sitting there in super, sitting there in investments, sitting there in their bank accounts, then I think it is only fair that there is some sort of additional means testing. So there's those who can afford to pay more may in fact end up paying more.
Yeah, we will see, but a worrying lack of detail in what's being put forward so far, so the debate is really yet to come.